Homeopathic medication, part 4. Since Hahnemann's time, other miasms have been proposed, some replacing illnesses previously attributed to Zora, including tuberculosis and cancer miasm. Hahnemann's miasms theory remains disputed and controversial within homeopathy, even in the modern times. The theory of miasm has been criticized as an explanation developed to preserve the system of homeopathy in the face of treatment failures and for being inadequate to cover many hundreds of sorts of diseases, as well as for failing to explain disease predispositions, as well as genetics, environmental factors, and the unique disease history of each patient. 19th century rise to popularity and early criticism. Homeopathic medication achieved its greatest popularity in the 19th century. It was introduced to the United States in 1825 by Hans Birch Graham, a student of Hahnemann. The first homeopathic school in the United States was opened in 1835, and the American Institute of Homeopathy was established in 1844. Throughout the 19th century, dozens of homeopathic institutions appeared in Europe and the United States, and by 1900, there were 22 homeopathic colleges and 15,000 practitioners in the United States. Because medical practice of the time relied on treatments which were often ineffective and harmful, patients of homeopath often had better outcomes than those being treated by medical practitioners. Though ineffective, homeopathic preparations are rarely detrimental. Thus, users are less likely to be harmed by the treatment that is supposed to be helping them. The relative success of homeopathy in the 19th century may have led to the abandonment of the ineffective and harmful treatments of bloodletting and purging and begun the move towards more effective science-based medicine. One reason for growing popularity of homeopathy was its apparent success in treating people suffering from infectious disease epidemics. During the 19th century, epidemics of diseases such as cholera, death rates in the homeopathic hospitals were often lower than in the conventional hospitals, where the treatments used at the time were often harmful and did little or nothing to combat the diseases. Even during its rise in popularity, homeopathy was criticized by scientists and physicians. Sir John Forbes, physician to Queen Victoria, said in 1843 that the extremely small doses of homeopathy were regularly derided as useless and considered it an outrage to human reason. James Young Simpson said in 1853 of the highly diluted drugs, no poison, however strong or powerful, the billionth or the decillionth of which would in the least degree affect a man or harm a fly. 19th century American physician and the author Oliver Wendell Holmes was also a vocal critic of homeopathy and published an essay entitled Homeopathy and Its Kindred Delusions. The members of the French Homeopathic Society observed in 1867 that some leading homeopaths of Europe not only were abandoning the practice of uh, administering infinitesimal doses, but were also no longer defending it. The last school in the United States exclusively teaching homeopathy was closed in 1920. We've also seen the revival of homeopathic medication in the 20th century, or so to say, in the last quarter of the 20th century, as we'll talk about it in the next video.